Hi everyone, it's Wednesday Warriors and it's me, Arielle. And this week I'm going to be talking about the therapeutic process from the perspective of the therapist. And I want to touch on a few things, particularly boundaries, transitions, and maybe what to do when your therapist goes on vacation or has to go out on a leave of some kind, and there's going to be some kind of an adjustment in order for you as the person who's in therapy. Sometimes it's very easy to see a therapist as just another person with his or her own problems, but I think what happens more often than not is therapists are seen as people who are going to work every day, helping people with their problems, and whether they're a good therapist or a bad therapist, when you think of a therapist, you think of someone going to an office or going to a hospital or going to some location and providing services. You don't often think of the person sort of behind the scenes in the other roles that they might have. So, just because we're all human, it's very easy to forget that your therapist might be a parent or might have maybe a second job in addition to providing therapy in an office or a hospital. Maybe your therapist is helping out caregiving for an elderly parent. Or maybe they're going to school. Maybe they have their master's degree and they're going for their PhD. Maybe they teach a few nights a week. Maybe they have health issues going on, chronic pain, diabetes, cancer. There are a ton of different things, even minor health issues that a therapist can be dealing with on a regular basis, and it doesn't have to affect their work, but it is still something else that they're doing on their own time, or that they are thinking about on their own time or dealing with on their own time. Maybe your therapist is having marriage issues. Maybe your therapist is dating and trying to find the right person. Maybe your therapist has a great relationship or a great marriage, and it just takes a lot of work, and that's just another role that they fulfill as a husband or a wife or a boyfriend or a girlfriend or a partner or a significant other. And I mean, these things are all very obvious. We know that anyone and everyone, no matter their occupation, has a life and is dealing with a variety of different things on a regular basis. But when we are sitting on a couch or sitting in a chair or sitting at a table across from a therapist or, across from a doctor or a teacher or anyone else in our lives, it's really, really easy to forget that they also have a life outside of that room and that they are dealing with any number of really, really awesome things or really, really bad things or a combination of the two. And this isn't to say that you need to start worrying about that or feeling bad for your therapist or worrying about if they're okay or if their health is all right or if they appear fragile. It's not for you to worry about. It's not your job. It's certainly not your responsibility, and that's not what the therapeutic process is all about. But it's always important, no matter what situation you're in, to sort of put yourself in the other person's shoes if you can, or just realize factually, logically, recognize that the other person, even though they may be in a helping profession or in a helping role for you, and they are providing a service, that they have other things going on. We're doing something new with our 4-week rotation, so I'm going to be answering a question each Wednesday for the next 4 Wednesdays, including today, from other members of the We Are Freedom Fighters team. So today I am responding to a question from Brianna. It's easy to understand it from the person who's in therapy. Maybe you are really grateful that your therapist gets to go away for a week or 2 weeks and do what he or she needs to do, and you're going to miss them, but you understand it. But there are a lot of reasons why people in helping professions do need to take a break for short periods of time, and it's also important to recognize why therapists have certain boundaries. So I would like to talk about that. And I can stress when I'm making this video that I have been the person in therapy for a period of years, and I have also been in the therapist role. So I have been a counselor for women in domestic violence situations, and even for some men too. And that brings up a lot of different issues. It's normally domestic violence isn't the only thing that's talked about in a counseling session. So, I've talked about eating disorders, I've talked about other forms of abuse, I've talked about childhood diagnoses, I've talked about all different kinds of mental health issues and just your average day-to-day problems that come up when I was counseling those people. I also have a year's experience doing hospice counseling, so talking to people who are at the end of life and who are dying, or talking to their family members or their friends and helping to prepare them for the process, and basically just learning a lot about grief and loss and the counseling process with that. And then, as most of you know, I've led an eating disorder support group for over 5 years, so I've had a lot of counseling experience face-to-face, doing things with eating disorders and body image and all the other things that those two issues bring up in a group setting. And then added to that, I've had a lot of training through getting my MSW with advanced practice for therapy and counseling and other issues like that. Okay, so it's important for therapists to have boundaries because they hear a lot of really, really difficult things. Just imagine for a second the deepest, darkest, most horrible or sad thing that you have ever told a therapist if you've been in therapy. And then imagine that a whole huge amount of other people have gone to this therapist and have disclosed any number of deep, dark, sad moments. And that therapist is kind of carrying that with him or her. And if they are a good therapist, they know how to sort of compartmentalize and help that person and not take that on themselves and not internalize it and, not go home with it. But a lot of therapists also go to therapy so that they can sort of decompress and self-care and keep themselves healthy mentally. And that doesn't mean that they go to their therapist and they just, disclose everything that their clients have told them, but they just, might talk about how that they've heard a lot of hard things lately, or they've dealt with a lot of grief, or they've dealt with a lot of loss, or they've dealt with a lot of traumatic events. Sometimes therapy can be an extremely rewarding job, and other times it can be an extremely heavy job where you feel like you're carrying the weight of other people with you. And obviously therapists, if they are good therapists, have chosen this path for a reason because they love to help people and they feel that they're equipped with training and with knowledge to be able to help people without taking on other people's problems for themselves. And that's a beautiful thing. But part of keeping that a beautiful thing is having boundaries. And boundaries might be something as simple as they don't answer their phone on the weekend unless it's a dire emergency. Or they don't always return your phone call the same day. They might wait till the next day. And when you're really struggling and things are really difficult and you need someone to talk to and your therapist is the only one that you feel you can go to, it can be really, really frustrating when you don't get that response as immediately as you wish you would. And I know because I've been on the other side of the chair being in therapy, but then from the therapist, the counselor perspective, it can be very difficult to return calls or get back to people as quickly as they would like because there are a lot of calls that come in and there are a lot of problems that arise in a given day. There might even be management issues if it's not a private practice. And there's just regular life issues. Like I said, therapists with children, therapists with spouses, therapists with second jobs or with parents. There are so many different things that can be going on in a given day. And it's actually the best thing for a therapist to do to sort of prioritize and understand what can wait and what can't wait. And the two sides may disagree. What you feel can't wait might be something your therapist feels can wait. And I think people are often going to be at odds with that, but we can only come to that middle ground from our own perspective, the client with their perspective and the therapist with his or her perspective. But I can definitely tell you, if you have a good therapist, and again, with any occupation there are good and bad, unfortunately so, but if you have a good therapist, then that person keeping those boundaries and knowing when they need to take a step back before they call you or before they get in touch with you or take care of other things first, whether it's personally or professionally, it's really for your own good and it's really for your best interest, because they're going to be able to be a better therapist for you if they can deal with everything in the proper order so that they can put their best self forward. Because you're paying for a service, you're investing yourself, you're putting in the effort and the work, and you deserve the best in return. And for that therapist to give you his best or her best, he or she really needs to be fully present and fully there. I could probably talk a lot about boundaries, and I actually did a whole workshop on boundaries with another MSW student when I was in grad school. We did it for some healthcare aides that used to go into people's homes when we were working for the hospice, and we actually were teaching them about proper boundaries when you are a professional in a situation, because it can be a lot harder than you think to keep those professional boundaries, especially when you're a very caring, kind, and wonderful person. But just in the interest of time, I want to skip over more boundary stuff, and I want to talk about transitioning or a therapist taking a break, because I know that's what Brianna really wanted me to touch on. So I'll start off by saying that a good therapist will always let you know in advance when he or she is going to be taking a break or taking a vacation or going on a leave. If a therapist tells you in a session, well, this is going to be our last session for a while because next time I'm going to be on maternity leave or something of, along those lines, that's really not professional of them, and it's really not compassionate and kind of them. A good therapist is going to let you know as soon as they know that this is going to occur so that you can plan accordingly, and maybe so the two of you can even talk about it in your sessions about what you will do while your therapist is on break. And you can talk about what you're worried about, what you're afraid of when the therapist will be gone. And it'll be this very nice open exchange of communication. And that's really the way that it should be. But also, they're giving you the respect to let you know in advance. I know that when I was counseling at the domestic violence shelter, I would let my clients know right away. Once May gets here, my master's degree school year will be over. And that will mean that my MSW internship is coming to an end. So that means that I will no longer be here as your counselor. And that way they would know coming into it, maybe they started seeing me, let's say in January, they would know that in May I wasn't going to be there anymore. And if that was a problem for them, then they had every right to say that they wanted to see someone else. If they thought that what they were coming to me for could be taken care of in a shorter amount of time, maybe it didn't matter to them at all. Or maybe they just really wanted to talk to someone, or they felt that they had a bond with me initially, and they wanted to see where it would lead them. And certainly every time I let someone know that I wasn't going to be there after a certain date, I would tell them that I could refer them to someone else, or that I would be giving their case to someone else in the agency who would help them. It wasn't like they would be put out on the street not to have any more services. They could see someone, they would just be seeing someone other than me. And I would let them know that I would try to make the transition as smooth as possible so that they didn't have to rehash all of the history, all of the reasons why they started to see me in the first place. Now, I'll be honest, normally some of that happens because when a new therapist comes in and they want to talk to you, they want to know as much as they can, and therapists work differently, just like artists or writers, we all do things differently. So they might want to ask questions that maybe I didn't ask. Or they might want to know something that they couldn't read in a file, or they might want to see your reaction to something when they ask you face to face. So there might be a little bit of overlap. And again, I want to say that it's for your best interest and for your own good, but I certainly recognize that it can be a huge pain in the butt when you are telling the same story a second time to someone else. And Sometimes there's no way around that, and, that's very, very unfortunate. But other times, it's still that the person wants to be invested in helping you, and they really want to do what they can for you. And sometimes life just can't be avoided. I mean, I was working for this agency. I was doing a year-long internship for a master's degree, so I was a counselor there, and I wasn't being paid, so it was understood that I would be leaving after a year. I couldn't stay on for free. If your therapist isn't retiring or isn't leaving an agency or something like that for good, and they're just taking a vacation or they're going on a break for some reason, like a medical leave, I think the best thing that you can possibly do is just lay everything out there, what you're worried about in their absence, what they feel is your best course of action as the therapist who's helping you, and just really talk about it. And as I said, a good therapist is going to let you know in advance. They're not going to tell you the day before they're going on a leave. I certainly hope that doesn't happen a lot. I know people do that. It's very unprofessional. It shouldn't happen, unless there's some kind of a crazy emergency that no one can foresee. But if they tell you, then you have ample time to work out a plan B, a different course of action. And they should also be able to tell you who you can call or who you can see in the event that you really do need to see someone while they're away. Now, that's, like I said before, the same thing that would happen if you were going to stop seeing this person permanently. They should be able to give you resources. They shouldn't leave you high and dry. They should be able to tell you, I can refer you to this person. Here's a list of people that are great. I want to help you be able to continue working on what we've been working on. Any good therapist should be able to give you the resources and the tools to keep moving forward even when they're no longer in the picture. And sometimes I know it can seem really annoying or even really heartless when a therapist stops seeing someone, but it can be something as simple as, they're retiring, they're 65, they're 70 years old, and they've worked really hard for most of their life, and they're ready to stop. Or maybe they're moving, they're moving from Pennsylvania to Texas or vice versa. Maybe they are being terminated and you just don't know, but the agency is downsizing and their job no longer exists. If you have any other questions about this, send them my way. You can comment right on this video, or you can send me an email, send me a message somehow, and I will try to answer them in a future video. I know that this is a very detailed topic, and there are plenty of other things that I would like to keep saying, but in the interest of time, I'm going to try to keep the video short. So I hope you're all having a wonderful week, and I will see you next time. Thanks for the question, Brianna.